Hello, this is Dr. Gay from First Look MRI, and this is a quick little pattern recognition test. And here we go. So this is a coronal PD fat set sequence, and the question is, what would you think is a diagnosis based on these two? A little bit of time to think about it. Okay, so here it is. So if we look on the lateral meniscus, we see a nice, beautiful lateral meniscus, nice and dark, and it's held in really tightly between the femoral condyle and tibial plateau, but the medial meniscus looks a little more loose. It looks like there's a little bit of pseudo-extrusion, drifted outward slightly. We also see degenerative signal within the meniscus, this foggy brightness within the meniscus. There's a little bit of intrasubstance degeneration. So the fact that this is not held in here really tightly like this is makes us think that there may be loss of hoop stress. And when we think about loss of hoop stress of the meniscus body or drifting outwards like this, pseudo-extrusion, and we see globular intrasubstance degenerative signal, we think about a meniscus root tear or just a radial tear of the posterior horn. So the loss of hoop stress allows for this pseudo-extrusion. So we're going to go backwards and see if it's true. And there it is right there. We see this bright band, which is fluid, right at the posterior horn root junction. So this is a radial tear of the meniscus root or posterior horn root junction, and it's allowing the meniscus to drift outwards because there's loss of hoop stress. The radial fibers are torn, and that's it. So radial tear of meniscus root. You'll see usually the pseudo-extrusion is much worse than this, but you see pseudo-extrusion and globular degenerative signal. Think about a radial tear of the posterior horn or typically the meniscus root.